Let's turn to maternal health. The world clock on ending obstetric fistula is ticking, but the number of girls and women enduring painful childbearing complication keeps growing, some unreported. Sarah Yeku reports.
Each year, about 50,000 to 100,000 women around the world sustain an obstetric fistula while trying to give birth. Obstetric fistula is a medical condition in which a hole develops in the birth canal as a result of childbirth. Experts say it is the most devastating of all pregnancy-related disabilities, and Nigeria accounts for 40% of fistula cases worldwide. About 80 to 95% of the cases of the causes of obstetric fistula occurs when a young woman experiences prolonged obstructed labor and has no access to cesarean section. For those in the southern part of Nigeria, it seems convenient to ignore the scourge of obstetric fistula and its damaging effects on young girls. But sadly, this is not the case of most of the girls I spoke with in Kano State, northern Nigeria.
I got married when I was 10 years old. I became pregnant, and at 7 months, I had complications and lost the baby. I am 17 and I have lost 3 babies within the space of 5 years. And I'm still recovering from VVF, and I still pee on myself.
Back here in Lagos, I met a gynecologist and fertility expert, a specialist who returned home for research and medical care in Nigeria. Due to the complex nature of fistulas and poor quality of care, women often have to receive multiple surgeries. Dr. Akonde explains how dangerous this birth condition is for women. And since most of them don't get to make a choice for themselves, treatment may be a tall order.
Obstetric fistula is a complication of childbirth, basically, and it's a major issue of concern. And unfortunately, we have also one of the highest obstetric death, maternal death in the world. Is it the one that connects to the bladder or the one that connects to the rectum? Either of them are treatable. On the average, it might cost, on the average, even at international level, it might cost around $500 to treat. That means that if you translate that into Nigeria factor, Nigerian exchange rate, you're talking of about 300 to 400,000 naira. These poor folks, these young girls, cannot, emphatically cannot afford that. So it's up to the government now to fund it.
Every year, international organizations keep spending money to offer free surgeries to these vulnerable persons. Although it's a welcome idea, observers say more needs to be done to address the political, social, religious and cultural factors that are causing obstetric fistula in Nigeria.
The whole budget of healthcare in Nigeria, even if it's devoted to obstetric fistula, is not going to cure it. So on one side, I'm a bit worried that it may not, but on the optimistic side, if we really focus on it, it is a possibility. So international organizations will try their best, but we have, in Nigeria, have work to do.
The theme for this year is End Fistula Now, Invest in Quality Health Care, Empower Communities, a reminder that more still needs to be done to eradicate the condition in Nigeria.